So back to that final ruling from the Supreme Court on affordable care. The Affordable Care Act subsidies specifically does not mean that the fight is over on Capitol Hill, of course. While there have been tweets and comments in support of the decision and against the decision, there are just as many who disagree and agree. So what's the next step? Where does Congress go from here? We have two congressmen, fair and balanced. Congressman Bradley Byrne, a Republican in favor of repealing the law, and Congressman Brendan Boyle, a Democrat who applauded the Supreme Court today. Welcome to you both. Representative Byrne, right off the bat, I'll ask you, you hate this thing. I mean, you are very upset about what happened today, I would imagine. But what's your next step?
Well, you can't stay upset. You've got to get back to work and make sure we do everything to repeal this law and replace it with something that works for the individual people of America and the patients that need health care. I've got people in my district that cannot afford the health care they supposedly have because they can't pay their deductibles. And in some cases, they can't pay their premiums. And in some cases, they can't find somebody to give them the health care they want. So in order to take care of the people of America, we can't afford to be upset. We've got to get back to work and make sure we fix this law.
Well, would they have been able to afford it if they had the subsidies?
Well, some of them have come to me, they do have the subsidies, and they found that even with the subsidies, they can't afford the deductibles that they're having to pay when they go to the doctor or the hospital. So they literally go to the doctor or the hospital and say, here's my insurance. They're told what the deductible is, and they walk away and don't get the health care that they thought they had.
Representative Boyle, a Democrat from Pennsylvania, what are you hearing about the Affordable Care Act? You have been for it, and you're standing next to a man who says, I'm going to work to repeal it, even though 50 other efforts by Republican congressmen have not worked yet.
Yeah, I think we're up to 59 to the exact count. I'll say I'm a strong supporter of the law. I think historians are going to write about the great irony that an idea that was created at the Heritage Foundation in the early 1990s became so politicized in a way that it has 20 years later. The fact is the law has worked. We have millions of people, over 13 million, who have health care insurance today that otherwise would not have it. And we also see for the first time in my lifetime the rate of inflation in healthcare actually coming down instead of going up. That's a positive development. And frankly, had the Supreme Court ruled in a different way today and we took away subsidies from people who were relying on them, that wouldn't have helped the situation. That would have only hurt, I know, 340,000 people in my state of Pennsylvania who rely on those subsidies, who are working Americans.
I want you guys to hear what we had earlier in the program. We had the CEO of Universal Health Services. This is a hospital operator, $14 billion company. Alan Miller's the CEO. Here's what he said. He's happy about the SCOTUS upholding this issue. Listen.
It depends on how many people are ultimately covered. You have an expansion of Medicaid. You know, if the economy picks up, it's starting to pick up, you'll have more people employed. They'll be covered by their employers. I mean, all of this portends for the future to be very good. And the other thing I want to mention, you've been following the consolidation or the attempted consolidation in the insurance market. That's very good for us, too, because if the insurers are stronger, the premiums that they're able to charge will be more firm. And so having more firm premiums, we'll be able to hope that we get paid as our expenses increase. So all around, it's a very positive thing for providers.
Representative Byrne, okay, he loves it. He's got a lot more people who are coming to his hospital, but they're covered at least. They're not showing up uninsured, and that maybe helps bend the cost curve. Do you see that at all or no?
No, I don't. I've toured every hospital in my district, which includes university hospitals, urban hospitals, and a lot of rural hospitals. This law is putting the rural hospitals out of business, and that's this consolidation you're hearing about. That's not good for healthcare consumers. It may be good for certain large suppliers or providers of healthcare, but it's not good for the average patient, the average healthcare consumer.
Representative Boyle, you're standing next to a guy who doesn't like what you really think has been good. You see two people totally...
Well,
looking at it differently.
He's not the first person to stand next to me and disagree with me. I would just cite the facts, though. I mean, and this is one of the reasons why when I was living in Massachusetts a dozen years ago, the then Republican Governor Mitt Romney pointed out and favored this kind of law exactly because in America, since we don't turn away people from the emergency rooms, we essentially already provide universal health care. We just do it in the most expensive and inefficient way possible. By requiring people to have health insurance, combined by pulling them together in the exchanges, It is the most efficient way to do it. I think the law is here to stay. Now let's talk about ways we can improve it, just like we did with Medicare 50 years ago.
Okay, well, you guys were joking earlier in the commercial break. You got two Irish guys standing next to each other. Maybe you can work something out, come up with some type of compromise. Good to see you both. Thank you so much.
Thank you. Good to be with you.
A fair and balanced discussion with Congressman Bradley Byrne, Republican, and Congressman Brendan Boyle, Democrat.